Hello and welcome. If you or someone you know is dealing with uterine fibroids, then you already know how much they can impact your life. Today, we're going to talk about a modern, minimally invasive treatment that gets right to the source of the problem. For years, so many women have been told that a hysterectomy or another big surgery is pretty much the only real answer. But what if that's not the whole story? We're about to explore a really powerful alternative that you might not have even heard of, one that offers relief without all the downtime and impact on your life. All right, let's dive right in. Before we can really appreciate this newer solution, we have to understand the problem itself. So, what is it about fibroids that cause these specific symptoms, and how are they actually affecting your body? So, at their core, uterine fibroids are benign. That means non-cancerous growths. And they are incredibly common, especially for women in their 30s, 40s, and 50s. But here's the key thing to remember about them. They're highly vascular. All that means is they have their own rich blood supply, which is literally how they grow and cause so many problems. If you're nodding your head at this list, you are definitely not alone. And these things are happening for very real physical reasons. The fibroids can actually distort the shape of your uterus. They push on other organs like your bladder, and they can lead to that chronic blood loss that just leaves you feeling completely wiped out. For decades, really, the whole conversation around fibroid treatment has been dominated by two major surgical options. It's the path a lot of women have been guided down, so it's really important we understand what that actually involves. Chances are you've probably been presented with these two choices. You've got hysterectomy, which is the complete removal of the uterus, a permanent solution for sure, but also a huge life change. And then there's myomectomy, where a surgeon actually cuts the fibroids out of the uterine wall. This preserves the uterus, but it's still a major surgery with a significant recovery. And this brings us to a really crucial question. What if we could just shift the entire approach? Instead of removing tissue, or even the whole organ, what if we could deal with fibroids in a totally different way? One that doesn't involve a single cut into the uterus. This is where modern medicine, specifically image-guided procedures, just completely changes the game. The new strategy for getting relief is all about going after the fibroid's lifeline. So this technique is called targeted fibroid therapy. It's a really specialized type of uterine fibroid embolization. Now, I know that's a mouthful, but the concept is actually very simple. Instead of surgically removing anything, the procedure just blocks the specific blood vessels that are feeding the fibroids. It basically cuts off their life support, and that causes them to shrink and die off all on their own. This is the perfect way to think about it. It really is like turning off a faucet. If a fibroid can't get the blood it needs to grow, it just can't survive. By cutting off that supply, the fibroids just naturally shrink down, and as they do, your symptoms start to get better. Simple as that. So what does this actually look like in practice? I know the word procedure can sound a little scary, but let's just walk through the process. I think you'll see it's way less invasive than you're probably picturing. Okay, first things first, you actually have a choice in how the procedure even begins. It can be done through a tiny puncture in your groin, or it can be done through your wrist. A lot of patients really prefer the wrist approach because it's more comfortable and lets you sit up and move around much faster afterward. And this really shows you just how precise this whole thing is. It all happens through a single pinhole. The area is numbed, and a tiny flexible tube, a catheter, is guided using live imaging right to the arteries that are feeding the fibroids. Then, tiny particles like grains of sand are released to block them off. And that's it. The catheter comes out, no cuts, no stitches needed. And check out this number. The entire thing is usually done in less than 2 hours. And maybe the best part? You go home the very same day. There's no required overnight hospital stay, which is just huge. All right, so the procedure itself is less invasive. But what about the results? What's the payoff? Let's talk about what really matters, what recovery looks like, and the proven results you can expect. This chart really tells a powerful story, doesn't it? Just look at the difference in getting back to work, about 1 week compared to up to 6 weeks for hysterectomy. No hospital stay, no scarring on your uterus, and just a tiny puncture instead of multiple incisions. It's just a fundamentally different and easier experience for your body. And the data on how well it works is just as impressive. We're talking about 85 to 90% of patients reporting a huge improvement in heavy bleeding. For so many women, that's the one symptom that just completely disrupts their life. And getting that kind of relief, well, it's a game changer. So what about all that pressure and bloating? Well, as the fibroids are starved of that blood supply, they shrink a lot. We're talking a 40 to 70% reduction in size. And that shrinkage is exactly what gives you that lasting relief from those heavy, bulky symptoms. So here's the bottom line. Having this information is empowering. It means you can walk into your doctor's office and have a totally different kind of conversation about your health, about your body, and about what you want your treatment to look like. So, who is this really for? Well, if you're dealing with that heavy bleeding or pressure, if you really want to avoid major surgery and keep your uterus, and if a much faster recovery sounds good to you, this could be a fantastic option. It's an especially great fit for women who are done having children and are really focused on getting their quality of life back. Now, this is a really important conversation to have: fertility. Even though this therapy preserves your uterus, it's all about what your main goal is. For women who are still trying to conceive, a myomectomy might offer better pregnancy rates. But for women who are focused on just getting relief from their symptoms, embolization is an outstanding choice. It's a critical part of the decision you'll make with your doctor. And this quote just gets right to the heart of it. This isn't about saying surgery is bad. It's about expanding your options. It's about making sure you know every single path that's available. Because for so many women, preserving the uterus really, really matters. So we'll leave you with this final thought. Knowledge really is power. A little while ago, you might have thought you only had one or two choices. But now that you have this information, you can be the one to lead the conversation about your care. So the real question is, what are you going to ask your doctor now?